Diverticulitis is the inflammation of one or more of those diverticuli can result in perforation of the peritoneum. As I said, common in adults. Most people don't really ever develop diverticulitis, even though they have diverticula. But it's most common in the left descending sigmoid colon, and they occur at weak points in the intestinal wall. There are genetic and environmental factors involved in a person developing diverticula. Diverticulitis, diverticulosis are multiple non-inflamed diverticuli. Diverticulitis is one or more of the diverticula are inflamed. Clear as mud, right? Everybody got that? Complications are perforation, abscess, fistulas, bleeding. Etiology and patho, common in the left descending. Sigmoid colon, develop at the weak points. Blood vessels pass through the muscle layer, cause genetic and environmental. Main factors, constipation, lack of dietary fiber. Other factors, obesity, inactivity, smoking, excess alcohol use, NSAIDs use. Diverticuli are uncommon in vegetarians, more prevalent in the Western industrialized populations. Diet is lower in fiber and higher in refined carbohydrates. Manifestations and complications. Most diverticulosis is asymptomatic. Can have some abdominal pain, bloating, flatulence, changes in bleeding, or changes in bowel habits. Most common signs. If it's severe acute pain in the lower quad, decreased bowel sounds, nausea and vomiting, diverticulitis. Older adults don't really exhibit their signs. They can be afebrile, they can have normal WBCs. They may have some abdominal tenderness. And kind of like we talked about with the ulcers, sometimes their first symptom is a perforation or a bleed. Complications. You can have acute, you can have chronic. Acute hemorrhage, perforation, leads to peritonitis. Same thing with chronic. You can have an abscess, stricture, intestinal obstruction. Diagnostic studies, sigmoid or colonoscopy. The CT scan is preferred diagnostic with contrast. Also have a chest or an abdominal x-ray to rule out other causes, more acute causes. What we're looking for called blood, checking the CBC, barium enema, blood cultures, rule out other things. Prevention, high fiber diet, decreased fat, red meat, not red mat. Red meat, physical activity. In acute diverticulitis, the goal is rest the bowel, clear liquids, bed rest, analgesics. Want to eat more fruits and vegetables, decrease our fat, increase physical activity. There is no evidence to really support that avoiding nuts and seeds is necessary. It used to be the recommendation, you actually would recommend, once you got diverticuli, that you watched your fiber in your diet, and that's no longer supported because there's really no evidence that shows that you need to avoid nuts and seeds. And in fact, more evidence shows that the more fiber you eat, the better off you are. During acute phase, all more severe symptoms, they may be, and when we're trying to rest their intestines, their NPO, they may be hooked to NG, to intermittent low suction. We're going to support them with IV fluids and antibiotics, keep watching them for signs of complications, and advance their diet as tolerated. Recurring complications may be treated with surgical resection of the area or temporary colostomy. Explain the condition, prescribe their regimen to them, high fiber diet, increase their fluids, and avoid increasing their inner abdominal pressure. As I said, they don't have to avoid seeds, they don't have to avoid corn and nuts. Straining it, for them to avoid straining when they're defecating, or straining when they're vomiting, bending, lifting things, wearing tight, restricting clothing. Weight loss is beneficial if they're obese. Any questions?
I got a question. When you say environmental factors, exactly, could you give an example what they mean by environmental factors?
Part of that is like some of the environmental toxins, like going out to eat food that maybe is contaminated.
Okay.
Or water that's contaminated, that you end up with a good, nice GI or parasite. Some kind of bacterial infection, virus, parasite. Any other questions?